Hi, the name is Norberto Maffei. I'm an obstetrician gynecologist, and today I'm here to talk to you about something that at the beginning you'll talk like, do I need this? Is this doctor going crazy? If you watch until the end, you will see that the information here is really cool and that many women need it. We're going to talk about female anatomy, that's right. Then you who are a woman will talk like this, oh drive.
Norberto, but do you really think I don't know?
Maybe you do, but did you know that many women don't know their own anatomy, that many women don't touch each other, that many women don't even look at each other, they don't know their own intimate region? And we're going to tell you a little bit about that. And for that I have this mold here, the female genital tract mold. I know that when you look at this here you'll say, doctor, but I know what this is. And it has a lot of names depending on the region. Perichita, Prosito, Papeca, Pentareca, Chabiu. Yes, each place has a name. But do you really know what it is? What is the name of each little piece of your intimate region? We will see. Let's look a little bit for you to see if you really know. And if you don't know, so that you never make a mistake again. So let's go. This right here is the female reproductive system. Let's start the way we are used to seeing it, head on. When we look at the female reproductive system here, many people say, oh, doctor, but this is a vagina, and in fact it is not. The external part of the female reproductive system, this whole region here, it's called the vulva, okay? So here at the outside, it's not the vagina, it's called the vulva. And in the vulva, we have some structures that we also need to know. This part out here is the labia majora or outer lips. Inside here we have the labia minora or internal labia. Right up here we have a little structure that both women and especially men really need to know, which is the clitoris. This here is the gland, it's the head of the clitoris. It's not just here, okay? The clitoris starts here, but it goes all the way down there. But the part of him that exteriorizes is this one, the gland. And it has a hood, it has a foreskin that you need to know about, because later when we talk about intimate hygiene, you will see how important it is to know that there is a hood. And here is the entrance to the vagina, which is called the interitus. So, look at this, labia majora or outer labia, labia minora or inner labia, introitus, entrance to the vagina and clitoris, clitoris gland, with the foreskin, and this whole area here is the vulva. But, doctor, what about the vagina? Doesn't it exist? Of course there is. We'll show you now. If we could look from the side, we would have the external part here, which, as we said, is the vulva.
There, Dr. Norberto, what about the vagina?
Where is she? The vagina is this part here. Look, it's the canal. It's the inside of the female reproductive system. So when you call the vulva a vagina, that's not right. The vagina is the inner part, just the canal. Continuing here in the bottom of the vagina, what are we going to have? The cervix. Here we have the uterus. Here we have the tubes. Let's see, the tubes, one on each side, and the ovaries. And this is the device, the female player. So, for us to remember, to never make a mistake again, part of the outside, vulva, outer lips or labia majora, inner lips or labia minora. Entrance, vaginal entrance, clitoral gland. Then, show this to the husbands, okay? Stay right here, oh. And it has the hood. Looking from the inside, vagina, look, the vagina is only inside, there is no vagina outside. Vagina, the vaginal canal, the cervix, it will be right here in the back. The uterus, tube and ovary. And this is the female reproductive system. There, in your region, they call the chabiu, little bird, prejudice. It's okay, no problem, you can call it that in conversations, when you're talking with your partner, with your friends, no problem. Now, when someone tells you, do you know what the vulva is? Do you know what a vagina is? You will know. It's because you watched this video and learned. And that's what we want, to make gynecology uncomplicated, to let you know your own body. This is very important to you. And that was our first conversation. Thanks.